So yeah, welcome to Kind 404 for the week. I hope everyone is doing well, that your semester is going well. We are in the 5th week of the class. So we're a little over a third of the way done, which is kind of crazy. Next week is already March, which I can't really believe. So we're coming up on 1 year of when we went virtual because of the pandemic. I think it was around March 18th or 20th that we went virtual because of the pandemic. So we're coming up on a year, it doesn't seem like a year. I don't know about you all, but time doesn't really make a lot of sense to me. I'll be talking to people on the phone or on Zoom. I'm like, oh yeah, this was last week. And I'm like, oh wait, that was 3 months ago. I can't, sorry about that. So it's very difficult to remember when things happen or what's going on. I forget a lot more recently. It's crazy. So hopefully you're all not facing that as much as me with being very forgetful because of the pandemic and just being stuck in home all the time. So a couple of things for today for Kind 404. Some updates in terms of your first homework had a goal due date of Sunday. I've noticed the majority of people have submitted it, so thank you for doing so. As you all know, most of the due dates in this class are flexible, so as long as you submit everything that is assigned before the midterm or at the time of the midterm, then you will get full credit, no questions asked. You don't have to ask for an extension. You can submit it anytime up until now, until the midterm. But I do recommend that you try to stay on top of those goal due dates, because if you fall behind, you don't want to have to do 3 homework assignments and study for an exam in the exact same week. It won't be fun, trust me. And it will make it a lot harder for you to do well and on the exam and in the class as a whole overall. So if you do find yourself struggling to meet the goal due dates or shortly after the goal due dates, please don't hesitate to reach out to me. Let's come up with a plan for your studying together. Let's come up with a plan for you to complete the homeworks and get them submitted so that I can work with you to make sure that you're all doing well and staying on top of things. Because I know it's very easy in this virtual environment for work to pile up because you have lots of reading, you have lots of assignments, you have lots of stuff going on in all of your classes, and then you have work and families and everything, and we're in the middle of a pandemic. So it's really easy for stuff to pile up quickly. And I just want to make sure that if you're feeling overwhelmed or like you're not able to stay on top of stuff, especially for this class, let me know early so that we can come up with a plan together to ensure that you're going to do well and get everything submitted. I can't help you if I don't know that you need help. So reach out to me and I'm happy to work with you in any way possible. So then your second homework assignment, I will post it later today. That has a goal due date of a couple of weeks from now. That will be based on this next couple of lectures, and you'll have to do some calculations again, and you'll have to do some word problems again. And then you'll have another homework assignment that'll be due about a week and a half after that as well. And that'll lead us up to our midterm exam, which is in 4 weeks or 3.5 weeks or so. I'll briefly mention the midterm exam now, but as we get closer to it, I'll give you more and more details. The midterm exam will have 2 components. It'll kind of have what I consider like a take-home component. Everything is take-home because we're all at home or at some place that's not on campus right now. But that component will be assigned early, and it'll be kind of like an essay or like a short answer question that you'll have to complete. And then you'll just submit that when you actually take what I consider the during class time exam, which will be short answer and multiple choice on Cougar Courses, where you'll log on to Cougar Courses. There'll be an exam link there, and you'll have 2 hours to complete the exam once you start it. But the way that I set up the exam is it will start at the beginning of a normal class period on the day of the exam. So at 9:30 on a Wednesday, the exam will open up. I'll hold a live session just to answer any last minute questions or anything. And then you will have 2 days. So you'll have until the next day, Thursday at midnight, to complete the exam. But once you start it, you only have 2 hours to finish it. So if you want to start it on Wednesday at 9:30, you have till Wednesday at 11:30 to finish the exam. If you want to start it on Thursday, you have until Thursday at 9:59 to start it to get the entire 2 hours to complete the exam. There'll be calculations and you'll do work. And the way that I normally do that is you're able to do the calculations on a piece of paper or on your computer. Once you've submitted your exam, you then upload the work that you've done so that I can see how you came up with the answers that you're submitting with your exam and assign partial credit. I give lots of partial credit. So even if you get the wrong answer, if I can see the formulas you've used, if I can see the steps that you've gone through to come up with the answer, I will do my best to give you as many points as I can based on the work that you did do. And so I'll give you more and more details as we come along and we get closer to it. As I've mentioned before too, the week before the exam, the class period, the week before the exam will be solely review, no new content whatsoever. We'll spend we'll probably all have a 2-hour live session that'll just be meant to do sample problems, answer questions, go over the more difficult concepts that we're learning about. And then I'll also hold additional review sessions outside of our normal class period. So what I'll do is I'll choose 3 or 4 times during that week leading up to the exam. And I'll say I'm available, or I'll be on Zoom on Monday from 4 to 5 p.m. If you have questions or want to review anything, log on and let's study for the exam. So I'll hold a couple of those sessions to give you all the opportunity to ask questions, to review, to make sure you feel prepared for the exam. I don't give a traditional study guide for the exam where it's like, here's exactly what you need to study. I do kind of do that during the review session the week before the exam. But what I do, and I'll post this later this week, is I post a whole bunch of sample problems. So similar to kind of the exercise 1 that we've gone over the last couple of weeks, and actually very similar to like homework 1 type problems, I'll post a combination of multiple choice and short answer calculation problems on Cougar Courses. And then along with that, I'll post the answers to all of those problems as well. I believe I've mentioned this before, all of those sample problems, all of the exercise problems that I give you, those are old exam questions. So basically I go from my exam from last fall, from last spring, from so on. I pull questions that I've asked and I put them on those sample problems to give you all the opportunity to know how I ask questions and what to expect. If you feel comfortable completing the sample problems and the exercises, you will do well on the exam. And so I'll post those up later this week, and then during review sessions and stuff, we'll walk through some of the sample problems and other things to make sure you're all as prepared as possible leading up to the exam. Any questions about that before just one last announcement, and then we'll jump into some of the lecture content. Cool. So the other thing is, so for this week, there is a quiz, but it's not really a true quiz. You don't have to study for it. It's nothing that you have to know. It's not based on the course content. It's really actually for me to get feedback from you all to see how you're doing and how the class is going right now. So I'm going to post the link in the chat now. You can copy it. You can go to it now and fill it out, when you have some time. It's also going to be on Cougar Courses as well. The feedback form that I'm posting is through Google Forms. It's completely anonymous, so you're not going to put your name or anything on it. What I would really like is any kind of constructive feedback or criticism. If there's something that you're just hating completely, let me know, and I will see what I can do to kind of adjust. Like, for instance, one of the things I know is I've been talking way too much in these live sessions. We've been going over time, all of these things, and I'm going to start to fix that, especially as we move out of this more intro information where I'm trying to get you the basics that you need to then move into calculations and stuff. And then what I want to do starting next week especially is a lot of the live sessions are going to be more based on us walking through problems, me putting you in breakout rooms, and you having an opportunity to practice what we are learning. And what that might mean though, and where I often struggle with some of this, is you have all the recorded lectures, and I review a lot of that in these live sessions. The reason being is if you haven't watched the recorded lectures before the live session, if I try to have you do a sample problem or an exercise problem and you've never seen any of the content before because you didn't have an opportunity to watch the recorded lecture before the live session, that sample problem is probably not going to go very well because you're seeing a problem based on content you've never been introduced to. So I'll always do a short review, at least, of the things that you absolutely need to know. But I would like you all to do your best to try to watch the recorded sessions before the live sessions, because that will allow us to actually discuss the material, me walk through sample problems. So actually, question for you, and you can just like raise your hand in Zoom. How many, and be honest, I don't care if none of you have, how many of you have been regularly watching the recorded sessions before live sessions? So I'm seeing about 10 to 12. Okay, so about 10 to 12 of the 32 that are here. So that is what makes it a little bit challenging, right? Is that some of you are watching it and you're like, all right, I've already watched all this content, which is awesome, and I want you to keep doing that. So then you can ask questions. But everyone else, if you can try to at least review it, that would be really, really helpful to be able to have more interactive live sessions moving forward. But I know you're all busy, right? There's a lot going on, so you're not always going to be able to. And what I'll try to do too is maybe point you to the things of like, at least go through this part of the recorded thing, so then we can do some exercise problems before class. So maybe it'll cut down and like you only have to do 15 minutes of prep before class versus 45 minutes worth of prep or something. So I'll think about ways to do that. So that is the link to the feedback form for the course. Like I said, constructive feedback, it's anonymous. Once you complete that, there is a link on the bottom. You have to go to Cougar Courses to basically mark that you completed the feedback form, so I can give you credit for it, because you get 5 points just as if it was a quiz. But the form in Cougar Courses is completely separate from this Google form. It's why I use 2 separate platforms to keep it anonymous. So if you can fill that out in the next week or so, I'll use whatever feedback you give me to try to continue to improve the course moving forward and provide whatever support I can for you all to do well in the course. And like I said, I really do value constructive feedback and any kind of things that you think you would need to be successful in this course that I can help you with. All right, what questions do you have for me while I pull up my PowerPoint?
Is that link the same link on the to-do list for this week?
It is, yeah. Yeah, so it's the same link that's on the to-do list for this week that I posted on Google Courses. Awesome. Okay, so this week we are talking about causal inference in epidemiology. And I will say that this is probably one of the more conceptually challenging concepts that we will talk about in this class. And what we're going to talk about is basically when we say that, for example, smoking causes lung cancer, how do we know that smoking causes lung cancer? And what have we done from a scientific standpoint and using research to determine that people who smoke are much more likely to develop lung cancer than people who do not smoke? And we'll kind of talk about some of the basic criteria that we use in epidemiology when we're conducting research to understand how disease develops and disease causality in human populations. So one of the reasons that I like to talk about this is, and I'll show you an example in just a little bit, is there's a lot in the media about what leads to poor health or good health. So if you open up any news site any given day, there's going to be a couple of articles that say drinking alcohol is bad for your health and people who drink are more likely to die 5 years earlier, or drinking alcohol is good for your health, so people who drink are going to be less likely to develop heart disease or diabetes or whatever it might be. Or another big one that kind of changes every couple of years is eating eggs is good for you. Nope, just kidding. Eating eggs is bad for you. So we see in the media all of the time these articles that are written based on research studies that say basically this is good or this is bad. The problem with a lot of that and the way that a lot of research is portrayed in the media is that most of the time, the journalists who are writing about that research don't understand the methods that were used to conduct that research study and the limitations that those particular research studies may have. And they don't understand how we can actually truly interpret the findings from that study. And often findings are overblown. And they'll take one research study and say, based on this one study that was often, unfortunately, very poorly conducted, we're going to say that if you eat eggs, you're going to be more likely to die 3 years sooner. And there's been studies that have shown that. But what we'll talk about not only today, but actually throughout the next 4 or 5 weeks is the limitations of the different ways that we can conduct research studies within the field of epidemiology to understand how different exposures or different behaviors that we engage in, such as eating eggs, might lead to good or poor health or exercise or alcohol consumption or whatever it might be that we're interested in studying. So before we get to that point, though, I just wanted to do a really brief review of infectious disease epidemiology that we talked about last week. So as you remember, infectious disease epidemiology, it's unique because a person who becomes infected can now become an exposure for other people. The ways in which people come into contact with each other plays an important role in disease spread. Immunity is often possible for infectious diseases, and vaccination is often possible. And there's sometimes or often a need for urgency when we're dealing with infectious diseases, such as with the COVID-19 pandemic. One of the things that I wanted to talk about that I didn't talk about much last week is this concept of herd immunity, or I actually like to call it community immunity. You've all probably seen in the media a lot of information about herd immunity and what that means for the COVID-19 pandemic. And especially early on in the pandemic, a lot of the responses to the pandemic in terms of lockdowns, masks wearing, and other things were different from country to country. And some of you may have heard or seen about the Sweden experiment, where they decided not to use a lot of the mitigation measures that other countries did and just kind of resumed life as normal to use what they were calling a herd immunity strategy. What herd immunity or community immunity is basically when a large enough portion of the population become immune or not susceptible to a particular disease, the spread of that disease is effectively stopped or highly minimized, where we don't see regular spread like we're seeing with COVID-19. That immunity can happen either via infection with the disease, if that infection causes long-term immunity, which not all infections do. There are many infectious diseases where you can get infected, clear it, get healthy, and then 2 weeks later, get infected with that same infectious disease because your body didn't develop enough antibodies and sustained immunity to protect you from it in the future. Typically, that future infection is much weaker and not going to be as severe, but you're still going to get infected again. It can also happen via vaccination, which is the strategy that is often most preferred because it prevents more significant morbidity and mortality in the population as a whole. And when we think about how herd immunity works, if we look at the figure here on the right, where the top left is percent vaccinated in the population 0%, so everyone is susceptible. And then we move up to 25% vaccinated, 50% vaccinated, 75, 90, and 95. If you look, I'm going to click forward and it's going to show you in these different populations that have different levels of immunity via vaccination, what spread of disease might look like.
What you were just talking about, is that basically what happened with some people that caught COVID and then got better from it and then got it again?
So with COVID in particular, we're still not 100% sure if once you get it, how long your immunity against getting infected with COVID again lasts. Right now, they're estimating at a minimum at least 4 to 6 months, I believe, or 3 to 6 months. But there's also the different variants of COVID as well that have slightly different principles, where if you get infected with one variant, you could still get infected with another variant or another strain of the virus as well. So there's a lot of different potential things with COVID where we're not sure how long the immunity from infection lasts. The recommendation still is, if you were infected with COVID-19, that you still get a vaccination, because it is believed still that the immunity from the vaccination lasts longer than immunity from the infection itself. We're actually still not 100% certain as well how long immunity from the vaccination lasts. It's thought to be about a year or so. It could be a little longer, it could be a little bit less, but right now I think most of the science is pointing to the fact that we're probably going to have to get regular vaccination against SARS-CoV-2 in the similar fashion that we get regular vaccination against influenza. So it might become a yearly thing where when you get your flu shot, you get your SARS-CoV-2 shot as well. And I would guess in the future, they're probably going to develop a vaccination that includes the vaccine for the flu and COVID-19 in the same shot, if they're able to develop something like that. So that is part of it, and why the strategies that some countries use to just say, let's just let people get infected and reach herd immunity, they're problematic for many reasons. One reason being, in order to get herd immunity, a large portion of the population has to get infected with the particular disease. How much of the population has to get infected depends on how contagious or how pathogenic the disease is. So for something like COVID-19, current estimates are about 70 to 85% of the population have to have immunity from COVID-19 in some way in order to effectively prevent or stop the ongoing spread of the disease in the population. For other diseases like measles, which is one of the more contagious diseases that we see spread in populations, it's about 95% of the population has to have the vaccine or be immune to measles in order to establish herd immunity. This idea of herd immunity is an extremely, extremely important concept in the field of public health for many reasons. One, because typically it's impossible for a vaccination campaign to be able to vaccinate every single person in the population because of access, because of vaccine hesitancy or refusal, and many other reasons. The other reason being is that there are people in the population who cannot get vaccinations for multiple reasons, whether it's because they have another health condition, an autoimmune disorder, or something that prevents them from getting a vaccine. So that means that they're not able to receive that protection. But with the concept of herd immunity, if enough of the rest of the population is immune and we're effectively stopping the spread, we are protecting those who are most vulnerable in a population from getting infected by preventing the spread of the disease in the population. So it allows us to not have to have everyone in the population immune and still effectively mitigate the spread of disease in the population. So the other reason that not relying on vaccinations is really problematic is we hear a lot about the death rate or the mortality rate from COVID-19. And there's a lot of articles about it saying, well, there's only a 1% death rate. And in some populations, it's only like 0.5% of people who get infected die. What that fails to recognize is multiple things. One, not only are people dying from COVID-19, and if you think about 1%, if we want to use a strategy of let's just everyone get infected, and we think about, say, 100 million people get infected, 1% of 100 million is still a lot of deaths. And if we think about that on a global scale, that's a large amount of mortality from a preventable disease through realistic measures to prevent the spread of disease, whether that is social distancing, masking, or vaccination. And then when we think about that as well, there are subgroups of the population, such as those who are elderly and those who have other health conditions, where the death rate or the mortality rate is much higher than 1%. So that means we're essentially saying that we're okay with some people dying at higher rates, just so the rest of us don't have to worry about what's going on, who are just going to have mild illness. Aside from that 1% death rate, what that doesn't take into account is a large number of hospitalizations, the cost to disease, the burden on our healthcare system, meaning that some people who need care for reasons other than COVID-19 aren't able to get it, And it also doesn't take into account what we call long COVID, or people who are getting infected with COVID-19, even when they might have mild symptoms, and them actually having symptoms of COVID-19 for many, many, many months. And they've actually shown in some people who are completely asymptomatic with COVID-19 that is actually still damaging their lungs and can potentially have long-term effects on health. And this is all stuff we still don't fully understand because it's such a new disease. So that the vaccination becomes extremely important to stop the spread, to not only protect the most vulnerable in our communities, but also to prevent ongoing burden of COVID-19 on our health system as a whole. And that's where this concept of herd immunity comes in, but we need to do it via vaccination, not just by saying, let's have everyone get infected in the population. So there's the figure again, you can see 0%, it just goes much quicker, up to 95%, you just see 1 or 2 people. I already kind of went through this, but in terms of prevention of infectious diseases, the thing that I'll just briefly mention here is that no one strategy is effective at preventing infectious diseases. We have to have a combination of individual and structural strategies that are used in combination with each other to prevent the spread of disease. And then one of the things that we've become more aware of, especially with COVID-19, but has been an ongoing thing with infectious diseases, is this concept that we call contact tracing. And the idea of contact tracing with an infectious disease is that essentially if somebody is infected with an infectious disease, if we're worried about the spread of that disease, then we want to contact everyone who that person who was infected, everyone who they came into contact with within a certain period of time, depending on the disease, to be able to inform them of their potential exposure, get them testing to determine whether or not they were infected, and to provide guidance to those contacts about what their behavior should be to prevent spreading that disease onto other people. So for example, for COVID-19, the guidance is that people should quarantine. And if they were exposed, regardless of their testing status, that they should quarantine away from others for a certain period of time due to the latency period of COVID-19, where it could take anywhere from 2 to 14 days for a person to develop symptoms. And there's also a period where we'll talk about this later in the semester with the disease testing, all of those screening tests that we use, they're not perfect. And so it's possible that someone who screens negative for COVID-19 actually has COVID-19. And there's multiple reasons why that could happen. It could be because the test wasn't administered properly, so that's poor reliability, or it could be because they're testing that person too early or too late. So for example, if you were exposed to somebody with COVID-19 yesterday and you got tested today, your body has likely not developed either enough antibodies or antigens, depending on the type of test, because there's different types of screening tests, for a screening test to pick up whether or not you actually have COVID-19. They say the ideal period is about 5 to 6 days or 5 to 7 days after exposure to the virus for your body to actually develop enough antigens or antibodies for the test to be effective. On the flip side, if you wait too long and it's been 10 days since exposure, then the test might test you negative because, again, your body has already mounted a response and you may not have active infection that can be detected by the screening test, depending on what screening test you use. So our tests are not perfect. They're really good at detecting disease, but they're not the end all be all of whether or not a person has it. And they shouldn't be the sole reason that somebody is using that to say, I tested negative, I can travel, I can see other people, because there are problematic things with the test and when and how they're used. And then the last thing I'll talk about with infectious disease is what we call the iceberg concept of infection, is that in that the number of active clinical disease that we see, and even with COVID-19, the number of people that we see that are testing positive, that's only a small proportion of the actual number of people who have disease, because it is impossible for us to test every single person in the population and to detect every single case of disease, especially with diseases like COVID-19 that have a large number of people who have asymptomatic infection, where they never develop symptoms. They may not have known that they were exposed, And so they never got tested. So we never detected that particular case. So likely the number of cases that we've seen from COVID-19 is actually much higher than we're actually estimating based on our tests. And that's true for most diseases. So for something like HIV, human immunodeficiency virus, it's estimated that about 1 in 5 people who have HIV do not know that they have HIV. So that's why we have really strong strategies and communication messages, especially in populations where the prevalence of HIV is high, for people to get tested. And the recommendation is for everyone, regardless of your behaviors and your potential thought of whether or not you're at risk for HIV, is that everyone in the population get tested for HIV at least once. And depending on your number of sexual partners, drug use, your exposures to other things, that recommendation for how often you should get tested increases. And so if you've never gotten an HIV test, I would highly recommend that everyone visit their primary care physician or a free clinic or another place. Planned Parenthood is a great place to get tested. There's lots of other free clinics where you can get free HIV testing at least once, because everyone knowing their status helps us to make sure people that are infected get on treatment to prevent the spread, and that we don't have people who don't know they're infected continuing to spread it on to other people unknowingly. So, especially because the asymptomatic or the latent period for HIV is up to 10 years and sometimes longer. So that means that a person can be infected with HIV, never develop a singular symptom, though the most common symptoms that a person develops after HIV infection is kind of like a common cold or flu-like symptoms, which we get all the time. And so it's very difficult to know, like, oh, this cold actually could have been that I was infected with HIV. And so most people don't ever develop any symptoms. And it could be 10 years from the time that they're infected to the time that they start to develop any symptoms and early stage HIV disease that could eventually lead to AIDS. And the problem with that is that we know now from research that the earlier someone gets into treatment, not only does that improve their prognosis and longevity, and that right now in developed countries where medications and treatment is available, HIV is a chronic disease. And people who are infected with HIV have the same lifespan as people who are not infected or very similar. And they now, our medication is so good that people only have to take about 1 pill per day. And they're actually developing some monthly shots where a person can take 1 shot per month. And that's their treatment for HIV. And they can live a normal, healthy life, have the same lifespan as people without HIV. The other important thing about that as well is that a person who's on treatment for HIV, if that treatment is working, what it will do is it will completely suppress their viral load, meaning that a normal HIV test won't actually be able to detect the virus in their body because it's laying dormant in their cells. And so it's not circulating in their blood. So what that actually means is we have this concept with HIV infection and prevention, what's just called U equals U, meaning that a person who is infected with HIV, if they're on treatment and the virus is undetectable in their blood, meaning that we do an HIV test and it doesn't show that they're infected, even though they have had previous positive tests and we know they're infected, that undetectable viral load means that that person cannot transmit that HIV to another person if they come into contact with them via routes that can lead to HIV infection. So undetectable equals untransmittable. And that's an extremely important concept for the prevention of the spread of HIV in our population, and why it's extremely important that we get everyone who is infected with HIV onto the necessary treatment that they need to not only prevent additional infection, but to prolong their life and ensure that they're able to live a healthy life. All right. So that's all I have to say about infectious disease epidemiology. Are there any questions that you all have about infectious diseases or anything else? If it's COVID related, I have some stuff that I could talk about at the end. I just don't want to spend too much time on that because I want to talk about causal inference for the rest of class and have you in a couple of breakout rooms. But any questions before I move on? Okay, so causal inference. So we're going to start out with doing a little exercise. So there were some recent headlines, and these are from the last day or two, that said that people who wear glasses are less likely to catch COVID-19, study suggests. So if you see, I did a Google search, COVID-19 and glasses. And if you go to the news section on Google, there are so many different articles that are specifically on glasses wearing and COVID-19. So what happened essentially is that a research paper, which is actually in preprint form, and we're not going to really talk about what that means, but it's basically not fully published in the literature, came out earlier this week or late last week that basically showed that what they're suggesting is that if you wear glasses, you are less likely to get infected with COVID-19. The media picked up on that, and there's now all of these articles about glasses wearing and COVID-19. So what I'm going to do is I'm going to put one of the articles that was picked up by the media in the chat. It's a Fox News Detroit, and there's many others. There's Seattle Times, New York Post, like probably 50 different articles based on this one research paper that showed that COVID-19 was prevented, or people who wore glasses were less likely to get infected with COVID-19. So what I want you all to do is I just put that there, and then I'm also putting what is the abstract for that paper in the chat as well. So in breakout rooms, what I want you to do, and I'm going to give you about 10 minutes to do this. You're first going to just kind of read through the article. What do they say in the news article about glasses wearing and COVID-19? And then I want you to read the abstract from the paper that all of these news articles are based on. And then after you've done that, based on this one study and these news articles that have all been published, do you believe that wearing glasses lowers risk for COVID-19 infection? Why or why not? And what I want you to think about is, how was the study conducted? So how did they collect data? How did they follow people if they did? What type of data did they collect? And you're only reading the abstract, so you're not going to have a ton of information, but you should be able to get a pretty good idea of what was done. Do they say what type of study it was? And we'll talk about the different types of study towards the end of this lecture. And what other information do you think you need to actually make a conclusion here? So I'm going to put you into some breakout rooms really quickly. Make sure you take the link to that journal article, and that you take the link to that news article, because you may not be able to see them after you go into the breakout rooms. They often disappear. So I'm going to assign you to rooms. I'm going to give you about 7 to 10 minutes. You don't have to read everything in depth. Just quickly glance through it and have a discussion with your people in your group. Do you think that if you wear glasses, you're less likely to get infected with COVID-19? Why or why not? Based on this one study that was conducted. Any questions before I open up the breakout rooms? Cool. So I'm going to create them. You should see them pop up.